Bladder leakage in women is it's a very broad subject, and it's something that can happen really at any point in a patient's life. Typically, we see leakage from stress urinary incontinence. Okay, so leaking when you kind of cough, sneeze, run, jump, these sorts of things. There are several different types of incontinence. There's stress urinary incontinence, where you leak urine when you cough and sneeze, run, jump, laugh, these sorts of things. There's urinary urgency, where you get the feeling that you have to go to the bathroom and you have to go that minute because your bladder is going to leak if you don't. I also see patients for prolapse of the bladder. Over time, that bladder can kind of drop into the vagina as tissues age and stretch and different things affect that tissue. That bladder can drop down and create some other issues as well. And there are very specific risk factors for developing stress urinary incontinence. The biggest risk for developing this is having been pregnant. Whether you delivered vaginally or had a C-section, carrying the weight of a pregnancy, that pressure against your pelvic floor breaks down some degree of your pelvic support. Your next risk factor, it would be having a vaginal delivery. So actually pushing a child out through that vaginal canal through your pelvic floor, there's a certain amount of stretching and breakdown of the tissue that happens with that process. If you had what's called an operative delivery, if someone used forceps or a vacuum to help you deliver, we see higher rates of prolapse and urinary incontinence following this. Patients with obesity. These things that increase pressure against your pelvic floor. The more weight you're carrying, the more pressure against your pelvic floor, we tend to see more issues than that situation. Patients with COPD, emphysema, severe asthma, things that increase their intrathoracic pressure, it pushes more pressure against your pelvic floor. You're at higher risk for that as well. Patients with chronic constipation, when you're constantly pushing against your pelvic floor to be able to have a bowel movement, you slowly kind of break down that support over time.